My name is Mac Benzon. I'm a sergeant with the Reno Police Department, currently charged in the narcotics unit supervision. I guess to describe our project in a very basic sense was that we saw a need for some type of intervention in the realm of prescription drug abuse, specifically among young people. We as an organization and as a community as a whole fell a little bit behind the curveball when we started to work in the realm of the methamphetamine scourge that kind of took hold of our community. And what we found is that we were behind all of the time. We had not enough data, not enough information regarding methamphetamine. And when we discovered that the problem surrounding the prescription drug issue was starting to rear its head, we decided that we would jump on it initially and try to do some, at least implement some sort of a strategy to curb that before it becomes a problem like we saw with previous problems. And so what we did is we launched a three-pronged effort really to combat the issues of prescription drug abuse among young people. And they really talk about, or we tried to focus on reducing the availability of prescription drugs, educating the public on the dangers of prescription drugs, and enforcing laws related to prescription drugs. And that took really a three-pronged approach for us, because in each of those subcategories related to prescription drugs, we figured out, based on some of the data analysis that we did, although small as it was, the amount of data that we had was small, we determined that the best method for us to do this was through educating doctors and pharmacists, getting all of the community involved and not trying to tackle it from a law enforcement perspective, but getting all of those stakeholders involved, doctors, pharmacists, involved in how we distribute prescription drugs, improving pharmacists' screening of patients, giving pharmacists an outlet when we talk about the enforcement angle to call somebody to contact in the event that they suspect some sort of prescription drug diversion, prescription drug abuse, something along those lines. I think in the past they hadn't had a way to, or didn't know of a way to try to combat that issue. Then we took on a real strong education component with developing media through the school district in our area and targeting young people for the message, and then targeting also their parents for the message, so that the young people understood the dangers of abuse of prescription drugs, and that the parents understood the ramifications if they left their prescription drugs available to their youth. And then lastly, our last component is the enforcement component. And that really was the tough part for us, or is the tough part for us right now, in that can we make legislative changes to our law, our existing laws, regarding the enforcement of prescription drugs and prescription drug abuse? And then also, can we educate the patrol officers to understand the laws and the changes to the laws so that they can take that out to the street and conduct enforcement that's readily available to them and enforce laws that are readily available to them?